Okay, so today we're going to discuss another topic. We have here the viral infections among the children. So we'll be discussing about the rubella, the MMR, we have here the measles, the mumps, and we have here the rubella, the rubiola. Okay, the measles, the mumps, and the rubella, or the causative agent, the German measles. Okay, so first we have here your rubella. So rubella is a single-stranded RNA na virus, is an envelope na virus. So basically, that one try to cause here your German measles. You get infected by the German measles through the respiratory droplets or even by transplacental. Okay, so the German measles most likely would have incubation period of 12 to 23 days. This is the viral infections we try to affect, number one, young unvaccinated patients. And we have also here your considered to be a benign self-limited na disease. So the virus here basically try to replicate in the upper respiratory tract. Then we have here your cervical lymph nodes. Then it go to your bloodstream. So we have here the manifestation. So I start here with the formation of your erythematous rash or maculopapular rash. And this one try to eventually found here in your face, then try to spread to your trunks and eventually to your extremities, which try to last here for 3 to 5 days. For adult patients, most likely this one would have your low-grade fever, swollen lymph nodes, and we have also here the upper respiratory tract infections, which eventually try to last here for 1 to 5 days. Other complications or manifestations. Okay, we have here other manifestation for adult women. They have here arthralgia, arthritis manifestation, or joint manifestation. Other clinical manifestation, so nasa PowerPoint tayo, encephalitis. We have also thrombocytopenia with hemorrhage. And then for a pregnant patient, the patient would have here stillbirth, miscarriage, and ang pinaka-complication here would be your CRS, congenital Rubella syndrome. Congenital Rubella syndrome characterized here by the deafness with the eye problem in the form of glaucoma and cataract formation. Meron siyang cardiac abnormalities, mental retardation, and we have here congenital malformation. Pag sinabing congenital malformations or that's your congenital defects. Okay, the vaccine available here for the German measles in the form of your live attenuated vaccine as part of the MMR or mumps, measles, rubella or MMRV, the 4-in-1 vaccine, mumps, measles, rubella, and your varicella. Okay, we have here laboratory diagnosis. Okay, to diagnose someone to have here the German measles, so we have here laboratory tests. First, you could have your perform your cell culture. Cell culture, kina-culture natin ang virus. It's not practical because again, ang result nito medyo matagal. So baka gumaling ng patient natin bago lumabas ang result nito. Then you could perform your antibody testing. So you are detecting for anti-rubella IgM and anti-rubella IgG antibody. So you could use your hemagglutination inhibition. That was a former gold standard na method, pero ngayon din siya ginagamit. You could have your hemagglutination, complement fixation. So most likely gumagamit tayo ng ELISA today for detection of your corresponding antibody. Okay, for acute infection or new infection, the patient would have here positive for anti-rubella IgM antibody, or could also have acute infection characterized by the fourfold increase in your anti-rubella IgG antibody. Pero kung one testing lang, then positive siya for anti-rubella IgG antibody, that would signify that the patient would have your past infection, or that might be because of product of your vaccination. So if the patient will have your positive for anti-rubella IgM antibody, could confirm that one by any of this one. Perform cell culture, could also perform here the detection of your IgG antibody, repeat testing after 3 to 6 weeks. Or could also have molecular diagnostic through your real-time PCR, which is my specific test for that, and very sensitive as well. One we have here the rubiola. Rubiola is a causative agent of your measles. So this is caused here by your paramyxovirus belonging to your morbilli virus. So this is a single-stranded RNA is also an envelope na virus. So basically, the virus here would have transmitted primarily by your respiratory droplets. Okay, so for the manifestation, first you have your Koplik spot. The Koplik spot is usually found in the inner cheeks and is characterized here by the presence of the whitish gray lesion against the very bright na red na background. And then the patient here would have produces a maculopapular rash or erythematous rash occurring here after 14 days of the infection. And the rash here started in the face, to the head, to the trunk, and we have your extremities. Okay, and eventually the patient would also have here some systemic infections. Systemic infection may occur here among patients less than 5 years old. Those are unvaccinated or adult patients. For the complications, okay, so the complications would be the following. Okay, we have here other complications with your complication of your measles. So we have here your diarrhea or otitis media, bronchitis. We have also here group, and we have here the pneumonia. The most severe one, we have here your subacute sclerosing panencephalitis, characterized here by the persistence of the virus in the brain of the patient that might occur 7 to 10 years after the primary infections. For dependent patients, resulted low birth weight, spontaneous abortion, or premature infants. But then again, good thing about that one, wala siyang congenital or motor disabilities. Okay, for the vaccines, the vaccine here is, so there is a transition to vaccine here. In 1963, the vaccine is a killed na vaccine, but currently, beginning in 1968, it became a live attenuated vaccines. And this vaccine against your measles also part of the 3-in-1 MMR or the 4-in-1 MMRV with your varicella. The vaccine here is being given in 2 doses. One is given between 12 to 15 months of age, and the other one is after 4 to 6 years. Basically, you should give the vaccine here within 12 to 15 months of the age of the baby, not less than 12 months. Kasi pag less than 12 months, it might result here to the ineffectivity of the vaccine because the vaccine might be neutralized by the maternal antibody. Okay, then we have here for the laboratory diagnosis. We have here the laboratory diagnosis for your measles. So you could have your cell culture, you could have your specimen for that. Again, impractical lang ating cell culture. Then you could have your serological test for antibody testing. So we're using the captured enzyme immunoassay. So we have that one anti-Rubella IgM antibody for acute infection. And this one is for the past infection. Okay, so we have that time kung sila siya nag-appear, nagde-decline. Again, for the acute infection, dapat IgM, anti-Rubella IgM positive siya plus fourfold increase ng kanyang anti-IgG antibody. Pero what is present only, like for example, is anti-IgG antibody lang, so it's a past infection. Then another one, you could also perform here molecular testing with your real-time PCR that would appear here positive after 3 days of rash appearance. Again, this is highly sensitive and very specific na test. Of your mumps. Mumps here is caused by your paramyxovirus then, which belongs to the genus na Rubella virus. This is also a single-stranded RNA and is also an envelope na virus. Okay, basically your mumps, the virus here try to replicate first in the nasopharynx, go to your cervical lymph nodes, then pupunta siya sa ating meninges of your brain, then pupunta din siya sa ating salivary gland, pupunta sa testes, or eventually pupunta siya din sa ating ovary. And try to cause here inflammation. Incubation period of your mumps approximately 14 to 18 days. And you get infected by mumps by respiratory droplets or even by fomites. Pag sinabing fomites, you could transmit that one by touching the surface. Then try to touch your eyes o lahat ng mga mucous membrane natin. For manifestation, so the patient here would have the presence of the parotitis. So parotitis is lumalaki dito. So this one is the earache with the tenderness of the jawline, which lasts for 7 to 10 days. But then again, not all patients would have manifestation of that. So almost 20% without parotitis, or 40% to 50% of the patient would have non-specific respiratory symptoms without parotitis. So another one, manifestation, the patients, some complications, we have asymptomatic meningitis. We have also symptomatic meningitis. Another complication, we have testicular inflammation, or we call it once or orchitis. Pag sinabing orchitis, okay, the testes of the male here try to inflame. Ang problem with that, ang danger lang pag ang patient natin ay lalaki and during the puberty period ang patient. So that's result here to sterility. Hindi siya makaanak. And then another one, complication would also have here ovarian inflammation, and we have also here the deafness.